Good morning, everybody, and welcome to Health Talk. I am your host, Dr. Niru Prassad, with my background in pediatrics, emergency medicine, and urgent care, affiliated with St. Joe, Pontiac, Henry Ford, and Beaumont. The theme of our health talk today is the major behavioral disorders among our children and adolescents. Joining us today as my guest speaker from the Care House, Oakland, are Chad Ozias and Tonya Womack. These people, I'm very happy to have them from the Care House where I have had guest speaker from them before, and they are going to talk to us about some of the burning topics, and then also talk about where do we send our referrals to the Care House when they go there, how we manage them. So good morning, Tanya.
Good morning.
I'm very happy to have you. Can you give your introduction to our viewers?
Yes, again, my name is Tonya Womack from Care House of Oakland County. I am the one of the outreach facilitators at Care House.
Okay, outreach facility.
Yes.
Okay, good morning, Chad. Can you give your introductions?
Hi, my name is Chad Ozias, and I am Director of Philanthropy at Care House of Oakland County, and super excited to be here with you again today, Dr. Prassad.
I'm very happy to have both of you today, as my guest speaker. So first question from Tanya. What are some of the common behavioral health issues affecting the adolescent today?
So some of the most common behavioral health issues that young people are dealing with now are signs of anxiety, depression. Mm-hmm. They may be dealing with self-harm, mental health issues. All of this can stem from the woes of life. It can stem from things that they are going through, things that they're experiencing, trauma that they may be experiencing either at home, in school, and the anxiety that they may be dealing with, depression, self-harm. Those are just a few, not the end-all, be-all, but just a few that teenagers are dealing with. It can, again, stem from a lot of trauma that they are enduring or just the woes of life.
Like a toxic trauma syndrome and all those
Yes.
that we have been going through,
Yes.
I read a lot and I did a lot of reviews and research studies, and I have found that in spite of the fact that we are trying our best, the incidence is still the same. So
Yes.
what is your opinion about the whole thing, Chad? You have to say something?
Well, I know that at Care House, our therapists are working with our clients on a daily basis, helping them to work through their trauma and the reasons that they've come to Care House in the first place. And we utilize a number of different modalities to help to minimize that trauma and provide our clients with the coping skills that they need to be able to deal with those issues that they're facing.
Yeah, so Chad, several years ago when I was working in the West Bloomfield ER, I used to send patients to you, to the Care House
Yes.
after they are stabilized. And then next day I used to go there and watch how you guys are handling the situation, and I was very much impressed to see how you handle the situation. So, Tanya, how do you differentiate between normal adolescent behavior and signs of a serious behavioral issue?
Yes. So normal adolescent behaviors, again, when they are going through their teenage years and early puberty and going through all those hormonal changes, there are bound to be some differences, of course.
Right.
So outside of like maybe slight mood changes, again, that could be hormonal as well. Outside of pushing boundaries. They're trying new things. They're trying to find their place. They're trying to find their circles of, where they belong or where they fit in their own community. So they may be starting to like push those boundaries and even test how far they can get away with things with parents.
Right, yeah.
But when it starts to become more risky, those behaviors can be more if they start to withdraw themselves, isolate themselves.
Social withdrawal.
Yes, from, of course, maybe their family, but even their social circles, they will withdraw themselves. They may deal with extreme mood changes. They may start to dabble in substance use as well, which can have a major effect on their health.
So these are the 2 points of differentiating, whether it is normal, functional because of the hormonal changes with
Yes.
growing. And here, these are some of the pathological issues. Okay. What do you have to add here?
I think that one of the signs and symptoms of abuse that we see is some of those big changes in a child's behavior. So I think it's really important for all the adults that are in the child's lives of kids to be paying attention to those
Right.
things. If a kid is a very good student and all of a sudden they're struggling in school, or they are super social and now they're very withdrawn. Those are some signs and symptoms that there may be something going on, and that child may be trying to ask for help.
Yeah. So, I also had my pediatrics office practice, and I worked at the emergency room, urgent care. The same people I saw at the emergency room, when it's a different picture when you see them in pediatrics clinic, right? Because there's so much difference, At the clinic, they are more calm down, and then we explain to the problems. So the bottom line is, at every level, these kids are supposed to be supervised, right?
Yes.
Every single level, whether it is at home, at the school, or at care house. Somebody needs to supervise them.
Yes, I agree. Children definitely need supervision as they age and they get later into their teenage years. Of course, they're going to have some sense of independency. They're going to be able to do more things alone by themselves,
Right,
like going out with their friends and things like that. So they do have some sense of independency, but
Exactly.
still a level
They
of
need
supervision.
a supervision. So,
Yes.
question for Tonya: how does trauma impact adolescent brain development and behavior?
So trauma can have a big impact on.
Yeah, I know.
Yes, I know that you know.
I am telling you.
Yes,
it's very true.
Yes, it can have
Toxic trauma syndrome, they have come
Exactly.
up, in the literature with the
Yes.
journals of pediatrics.
Yes. So it can, as you know, can have major impact on their behavior outcomes. Just from, again, if you look at ACEs, adverse childhood experiences, those traumas that children deal with or they may go through at a young age can have a direct health outcome when they get older into their adulthood years.
It lingers in their brain.
Yes,
Yeah.
yes. And we have to remember, too, that, our brains don't develop fully until our late 20s. So when children are going through trauma, they're bound to have some sort of output or showing that, something is not right.
Right, yeah. It affects the brain development.
Yes, it can
And
rewire the brain.
It could be from very beginning, like when I was doing my research study, even early childhood, like 6-year-old something, you can see those stigmas, right? So, Chad, what do you have to add? Give your expertise opinion on this.
Well, I'm not an expert on trauma in any way, but I do know that.
But you see the sequelae at care house.
Yeah, at care house we see kids as young for forensic interviews as young as 2 and verbal, all the way up to teens. And so, to your point of the kids that are much younger, they maybe they don't really understand the trauma that they've been through, but it's our role to help them to navigate that trauma, and for our staff to help them to learn the coping skills that they need so that they can move on from that trauma and live a happy, healthy childhood.
Yeah, so basically it is the basic stigma that stays in the brain of this developing brain, and then the kids accordingly act around that field, right?
Yes, but also it's important to know that children are very resilient.
Yeah.
So if they do have that positive person, that positive buffer within their life, it can definitely change the trajectory of their life.
Exactly.
Regardless of the trauma that they've been through.
Exactly. So now let us go back to the school health system, how they can affect, help prevent, and address. Do you have anything to say about the school health? Because teachers are the one who are watching them, right?
Yes. So ways that schools and communities can help. I think it's really important for youth serving organizations to be able to really train their staff on what mental health is, what it looks like,
right.
the behaviors that students may display to show that they've been through trauma. I think it's really easy to see a kid that maybe is declining in the classroom or they're having a hard time maybe sitting still or they're having behavior issues in the class, and it's really easy to label them as a bad kid, but not really having that trauma-informed approach and trying to get to the root as to why they are behaving the way that they are.
So it is, go ahead. So it is very important for the school system to recognize who has the issue and who needs to be sent to you or the pediatricians.
Yes. So it's important for for schools to be trauma informed, to know how to approach children, to know the right questions to say, and not, maybe not be quick to just label kids, but really care for them.
Right. Do you have to add? What do you have to add to her?
Well, Tonya and Carolina from our team at Care House do an incredible job of educating our community in a number of different ways.
Facilitator.
We do. They do.
Yes.
They do trauma-informed training, trauma and toxic stress. We have an online mandated reporter training and an in-person. We can do training in schools for teachers, for the students themselves. So the more people that we can educate on how to keep kids safe and how to be aware of those different signs and symptoms of trauma and abuse, the bigger community we can create to help keep kids safe.
Help these people, So what risk factor make adolescent more vulnerable to the issue? Like this is entirely a different chapter, substance abuse, depression, and suicide. This is entirely a different issue. But what are the risk factors that precipitates them to that?
So a young person that maybe have a lot of vulnerabilities. So vulnerabilities can be a list of things. So maybe if they don't have a good home life, if they don't have a lot of
family.
Yes, they don't have, if it's dysfunction in the home, if they don't have any social support, if they are dealing with low self-esteem, inferiority complex, if they are dealing with feeling out of place, not having their community, they're trying to find their fitting, their belonging.
Loneliness, depression.
Yes. Those kind of vulnerabilities. Also, if they are a part of the foster care system, juvenile system, or in ways that makes them more vulnerable to these risk factors of behavioral issues.
Okay. Chad.
So
your expertise.
Well, so Tonya had mentioned the foster care system. We at Care House we have the court-appointed special advocates program for Oakland County. So when kids come into foster care, typically due to abuse and neglect situations, our highly trained CASA volunteers are paired up with a child through family court, and they're one person that they can count on no matter what. Every kid deserves that one adult that they know is a safe person and a person that will advocate for what's in their best interest at all times. somebody that they can learn to trust. If you've come into care because of abuse, and it was the people that are supposed to be taking care of you, your parents, your caregivers, then you
build
have
up a
lot of
relationship.
Yeah,
build up
that
a
trust
relationship.
has been broken, and so now and you may bounce from one foster placement to another because of your trauma and your behavior issues, and have a bunch of caseworker turnover. But the kids that we have in the CASA program, which last year was 106 children here in Oakland County, all have that one safe adult that they know is looking out for.
I read through, Chad, you don't remember. Several years ago, working at the ER, I saw this girl with a suicidal gesture, a big laceration, bleeding, this and that. We took care of her. We talked to the parent. We said, we are not going to send her home. We are keeping overnight at the Maple Grove. And then next day, she goes to your facility. And I was there, not the next day, but the day after when I had a shift there. And I could see what a difference of change, because you had volunteers, you have the parents, and you had everybody involved there. So would you comment, Chad, on the social media and digital influence about to this, what we are doing at the care house, since you are there in the care house? What are the options? What are the things that you are doing, involved with?
Yeah, so Tonya and Carolina and our community education team have a program. It's a online sexual exploitation training, and when we were piloting some of those trainings, we did a like a staff version, like to kind of roll it out, and I was completely blown away about the number of apps and websites and other things that I had never even heard of that perpetrators were utilizing as a way to gain access to kids. So I think it's so important for us as a community, and for parents and caregivers and teachers and everyone that's involved in the lives of kids so closely to have some of that training, and to learn about all these different things and ways that that we need to know how kids are interacting online. When I was a kid, if I was being bullied at school, when I went home, that was it until the next morning. Now it can continue to go on all day long, all night long.
Bullying,
Notifications from your social media popping up that somebody is saying something awful about you. So I think it's really important for caregivers and parents to be informed, and to be monitoring those things, and making sure that they're checking in with their kids. And
So on an average, how many kids, because you are in Oakland County, how many referrals? Just an average every day, how many do you get?
So all of our forensic interviews are scheduled by law enforcement from each of the different jurisdictions here in Oakland
law
County.
Enforcement.
They schedule the forensic interviews. In 2024, we interviewed a little bit about 919, I believe, kids we interviewed.
That many you saw in 2024?
Yes, just for interviews, forensic interviews.
Yeah, and that's just for the forensic interviews. In 2023, we were at about 734.
So incidences has increased. The number has increased, right, in 2024?
Yes, and I know that we've done a lot of, Tonya and Carolina and our team has done a lot of community education. Our Director of Intervention has been doing a lot of education for new CPS staff and law enforcement. So we know that number, I think that the number may have increased, or most likely increased, because of that outreach, and everyone knowing that, hey, if there's a kid that needs to be interviewed, that should happen at Care House. Our prosecutor here in Oakland County, Karen McDonald, yells that from a rooftop to every jurisdiction. The best chance for them to be able to prosecute is for the interview to happen at Care House. The more kids that get to us, the better. The more we're able to help them. If a kid doesn't get to our door, then we don't know that they need our help. They can't get that referral for therapy services.
Right.
They can't participate in our family support group. They don't have that wraparound service that we provide to our clients. So when a kid gets to our front door, I'm happy for them, because I know whatever they need, we're going to make sure that we help them and get them the support they need.
So, question from Tonya, up till what age you follow them up? Do you have a follow-up sequence with that? Till what age you follow one particular kid, or it's just a general?
It's more general when it comes to
the
community education. So again, we're able, like Chad said, we're able to go into schools and communities and educate on a lot of different topics just to help people keep children safe. When it comes to, I know you mentioned something about social media.
That is very important nowadays. Social media, those TikToks and whatever they have.
Yes.
Texting.
Yes.
There should be some limit on those, right?
Yeah, so we do have parent programs where we educate parents on the harms of social media and not
ups and downs.
Yes, because when it comes to social media and the use of like smartphones and devices and video games, it's not something that we can just take away from kids. That's the easy way out, saying like just give it here, you can't use it, and you're done. But really, we have to learn how to navigate it with children. Yes, because it's just the way of life. This is what they're using. This is what they're doing.
And you cannot take them away from
No, it's hard to take it away, but you can put boundaries and parameters around there to help keep children safe. So in our program, when we do educate children on like not sharing their information, only game with people that you actually know in real life, teaching parents the same thing so everyone is on the same page as to what is the safe way to go. It's kind of surprising the many times that we do educate, how many parents I hear say that it was a stranger talking to their kid on Roblox and how they had to take those things away. So having that education piece for prevention is very important for the community. Yeah,
that education is very, very important, isn't it, for the kids and also for the family, parent. Because if the parents are hooked to the TV, naturally these little kids, or adolescents, their brain is immature. They want to know what they are doing, and then they like to do that, right?
Yes.
Yeah. Okay.
Yes.
So that's good. I have prepared a webinar after this when I do it, and I have explained with the brain anatomy which part of brain is it. It is hard to explain, but once it is ready, I will send you guys the link to it so you can see how the brain develops, like in the little kids, growing kids, they have this amygdala, the one that sits next to the hippocampus.
Yes.
And that is the area that gives impulse, means what? And then through the neurons, they go to cortex area, the subcortical area, which tells them, no, don't do this. Here it says do it, they say don't. And also, that is the area responsible for serotonin production and all that to calm down. So the basic thing is that these kids, they're supposed to be watched not through one time when they go to care house. They should be followed up all throughout by the Oakland County education system and all that, right?
So when kids come to Care House for when there's an abuse allegation and they're coming for a forensic interview, we have our staff, other staff that meet with their caregiver. and they follow up with the caregiver multiple times after they've been there for the interview to make sure that that they've received a referral for other services they may need, to see how things are going, how they've been able to navigate, talking with their child about what happened and what the next steps are, and really just being a point person for them for whatever they need.
So that's very good, because I really think that it's not just one particular issue. Pediatricians have a major role in this, from emergency room. They go to Maple Grove or some other facility, then they come to you. But bottom line is, pediatrician, they play a major role
For sure.
in diagnosis and maintaining those kids' behavior. You agree with me?
Yes, I do. Especially catching it at the beginning, because you all are mandated
Right,
reporters,
yeah.
So being able to report those things as you see it too.
Yeah, so how about you? Do you have anything to say about this whole thing?
Yeah, I think that it's important for mandated reporters and really just all the adults that are in the lives of kids to be knowledgeable on trauma and be trauma informed and know the signs and symptoms of abuse, because that's how we keep kids safe, and that's how we know if they're reaching out for help, because of what they might be saying and then knowing what we can do next to help. Our vision at Care House is to impact the safety of every child in Oakland County.
Right.
And we can't do that without the community.
Yes.
Right. So, for the American Academy of Pediatrics, they have all approved this psychological testing, DSM-5, and all those. So they can be done at the office, and then the results can go when they come to you. So, what is the last minute keynote advice? I will start with you. Last 1 minute, what would you advise?
I would encourage anyone that's in the lives of children to visit our website. It's carehouse.org.
Okay.
There's a lot of different resources. There's access to information about our community education opportunities, to really inform themselves and get the knowledge to help keep kids safe.
Help those kids.
You can get the information that you need to be able to have a conversation to keep the kids safe in your life, and also to be able to know how to help if those kids need help, right? So the more we're able to educate in the community, the more kids will know the safe adults, the mandated reporters that are in their life. They will know that they can go to anyone in their school and ask for help, and then they can get the help that they need.
Okay. So you agree with whatever he said?
Definitely agree with
so
that.
Now, I'd like to thank both of you for coming to my health talk show. And the topic was the major behavioral disorders among adolescents. And both of you are from the Care House, Oakland. And I'd like to thank our viewers for watching my show today. I'd like to thank our producer for helping me produce this wonderful video tape. And until I see you guys again, have a very safe winter and upcoming spring. Thank you again.
Thank you,
for
Dr.
having
Prassad.
us.